of years ago when I passed a bill doing away with cost sharing and for behavioral health services. After we passed the bill, there were a number of people who benefited from it, but the feedback was, it's great that you got the financial barriers, but there's no one there to provide the care. And the main reason no one is there to provide the care is that historically, throughout the country and here in New Mexico, we do not do reimbursement payments for the immense value that mental health care delivers. Now, I've been a physician and a physician executive, whatever that is, for over 40 years. And in that, I have supervised mental health programs and so on. And so I've become very familiar with the issues. But I, as so many of you, all of us, have had the lived experience in my own nuclear family with behavioral health. And it's extremely painful and it's awful to watch. And rare is the family, the nuclear family, that does not experience some issue with substance abuse and or mental health. This is a major, major issue, as I said, really the main crisis in healthcare in the U.S. So, I can tell you as a doctor, we have somehow, in healthcare, in our culture of healthcare, separated the head from the body. It's like the head doesn't exist. And the mind doesn't exist. And you know, this is so bass-ackwards because the body cannot function without the mind. So, we have to refocus our entire culture of healthcare. And this is going to be very tough. And we particularly have to refocus the culture of how healthcare gets paid for. Right now, medical surgical issues are addressed and seem to be the only issues. And when it comes to the mind and its impact on chronic disease and the rest of the body, it's like, well, it doesn't really count. It's only the thing we can see, feel, touch, manipulate that we're gonna pay for. That doesn't work. There are substantial studies from the nation's most eminent actuarial company demonstrating that if we would, as health plans, as societies, as medical delivery systems, focus first on mental health and substance use disorder, and they often go together, and treat those first and get them stabilized, the cost to do that would be minuscule compared to the savings that when those mental and substance use issues are stabilized, the chronic disease costs tumble by a factor of 3 to 4. So to address the mind first is actually going to save health plans money. It's going to help their margins. But I can tell you, I've run health plans for over 13 years in my career, as well as medical groups and hospitals. That's just not the mindset. They make money the way they've always made money, and they won't venture into doing the mental health approach first. So, that has led me to look around the country, and of course, a little bit of history. Our Senator Domenici passed the first mental health parity bill in 2008. That has been supplemented by the ACA, the CARES Act, the Cures Act, and multiple appropriation bills in Congress. So, in looking at mental health parity, while we studied it, we realized we had to examine about 8 bills and pull it all together and clarify it for New Mexico. And so today, later, I am introducing New Mexico's mental health parity bill into the Senate. And most importantly, if there aren't people to oversee it, to help implement it, to enforce it, it's not worth the paper it's written on. And it has a $1.5 million appropriation to go with it to support 8 FTE and the consultants we will need to be able to work with the health plans so they can do the heavy lift of having a policy on how their approach to mental health creates no more barriers, no more restrictions than is done for medical and surgical. That is a sea change in the health plan world. And they have to write those policies, and you, as a provider or as a patient, will be able to go into the health plan or call them and say, I want to see your policy. They must produce it. This is federal law. This is clarifying that we will do it in New Mexico as well. And in the federal law, unfortunately, there was no money to enforce mental health parity. So that is why we had put in this funding appropriation, because again, we want to work with the health plans. We don't want to come out and play whack-a-mole right out of the gate. We want to work with them to get the policies in place so there's a common understanding, and the Office of the Superintendent of Insurance knows exactly what they are dealing with. We want this to be collaborative. And as I said earlier, this is going to save health plans money. They're going to make money off of this. When I ran New Mexico Health Connections and True Health, we were the cheapest on the exchange because we did this. We got rid of, we did the cost sharing, and our emergency room visits were much lower, our admissions were much lower, because we treated the mind first. So, what does this law do? It clarifies federal law, pulls all the pieces together. It provides funding for the work with the health plans to do the heavy lift on policy, provides oversight. It actually levers the health plans, and this is through federal requirements, levers the health plans to keep raising the reimbursement rate to licensed behavioral health providers in all of the regions they cover in state. It's called network adequacy. They have to keep upping the offer of reimbursement until they can attract and retain licensed behavioral health professionals in every area in the state. That is huge. Because substance use disorder, as many of you know, an individual agreeing to enter into treatment and therapy, sometimes it's a 10-hour window and nothing more. Bad couple of days, talk with the family, okay, I'm gonna go. You've got that magical moment to take them to a residential treatment center or get them into an intensive outpatient therapy program. A day later, well, things have changed. Well, maybe I don't need it. So this law requires no prior authorization and no referral to seek out that therapy, and that is only common sense. And one other thing that stands out in this bill, and this is different than federal. Right now, marriage, family therapy, couples therapy is not covered. The health plans say you've got to have a mental health diagnosis to get coverage for it. Well, wait a minute. Let's step back. Where does mental dysfunction often start? As a child in a family when there's conflict. And so we have to get to the root cause, pay for marriage, family, and couples therapy. And that is in this bill. So in closing, I want to say, this bill will be a major paradigm change for New Mexico, as it is slowly doing federally. But we can't wait for the feds to get as far and as fast as we are going to go. Ironically, it'll increase health plan margins, if they'll figure that out. It will increase the compensation, the payment to behavioral health providers, so they will want to come to New Mexico and stay in New Mexico, and so they can get the therapy they so desperately need. And most important, it's addressing this crisis in mental, behavioral, substance use that is sweeping the nation. We have to stop and recognize it, and we have to put the resources forward to deal with it so that individuals can get back to a full and productive life. So we can stop the pain of mental health, which is as worse or more excruciating than any physical pain. And you know what? It isn't just the individuals. We need to stop the pain in the family. So thank you for your attention. Help support me get this through the legislature, get it funded, get it signed, and turn it into New Mexico law. Thank you.